The physical exam I will be doing is on the head, the eyes, ears, nose, and throat. When starting out examining a patient, I look at the skin. When looking at the skin, I'm looking at the color, the temperature, the moisture, the turgor, edema, texture, any bruising, lesions, scars, and any unusual navi. I would inspect and palpate, and then I would look at the head. When looking at a patient's head, I'm looking at the size, the symmetry, and that it's midline position. Move on to the inspecting and palpating the scalp. When inspecting the scalp, I'm looking at the hair distribution, the hair color, and the texture of the hair. Looking at a patient's hair can tell us things such as illnesses such as hypothyroidism and hyperthyroidism. I would then palpate the scalp. When palpating a patient's scalp, I'm palpating for tenderness, any depressions, lesions, any masses, and any infestations, if the patient might have any bugs in their hair. So, from there, I would move on to palpate the patient's temporal arteries and ask the patient if they have any tenderness when palpating them.
Nope,
Okay.
I do not.
Move on to the ears. When inspecting a patient's ears, I'm looking at the size and position of the ears. Looking at the size and position of the ears, depending on where a patient's ears sit, it could tell us such illnesses such as if the patient has Down syndrome. From there, I would look to examine the auditory canal and the temporal membrane. When examining the patient's temporal membrane, we will be looking for any redness and swelling, which could be a sign of ear infection. From examining, moving on to the ears, I would palpate the tragus and the pinea, looking for any masses and tenderness. So if
No tenderness.
Okay. Moving on, I will look at the patient's eyelashes and eyebrows, looking for any drainage or crustiness. Could be a sign of conjunctivitis. I would also assess the patient's scleria and conjunctiva. What I'm looking for here is the color and any lesions and drainage. Okay. I would also, if I had an ophthalmoscope present, I would check the red reflex and internal structures of the eyes. I don't have an ophthalmoscope, so I will be skipping this part of the exam. I would then move to the nose. When I'm looking at the patient's nose, I'm looking to make sure that the nose is straight and midline, and make sure that the patient does not have a deviated septum. I would also assess the nasal passages, looking for the patency of the nasal passages. If the patient's passages were pallor, it could be a sign of chronic allergy issues with the patient. I would then assess the sinuses for any tenderness.
No ma'am, no tenderness.
Frontal and maxillary sinuses.
No tenderness.
Excellent. I would then move on to the mouth. When I'm looking at a patient's mouth, I'm looking at their lips, their gums for any signs of gingivitis, teeth, any cavities or decaying teeth. Looking at their tongue, the boca mucosa, the palate, the soft palate, the posterior pharynx, and the tonsils, which this patient has their tonsils. Good job. Also look at the floor of the mouth, and I'm looking at the salivary ducts of the patient. Excellent. When assessing a patient's tongue, it's good to look at not just in the anterior aspect of the tongue, but also on the sides of the tongue. Because depending on the patient and their history, if they have a history of smoking, they could have some cancer lesions on the side of the mouth. Then we move on to the neck. Same thing, looking at the skin, as all the things I previously mentioned, the color, the temperature, the moisture, the texture, the turgor, any edema, lesions, scars, any unusual nevi. And then the lymph nodes. When assessing the lymph nodes, I would assess the preocular, the postocular, the occipital, the tonsil, submandibular, segmental, the anterior. Relax. There you go. The anterior, posterior, and clavicle. Okay? When assessing the patient's lymph nodes, what I'm looking for is any enlarged lymph nodes that are signs of infection. Then we move on to the TMJ. And what I'm looking for here when I'm assessing the TMJ is any misalignment, crepitus, or tenderness. Good. Excellent. And last part of the exam is the thyroid gland. For this part, I would have to get behind the patient, extend your head. Perfect. And swallow for me. Good. Good job. I'm sorry. All right. That concludes that part of the exam. Then we move to the cranial nerves. I'm going to start out with cranial nerve number 5, which is your trigeminal. This is a 2-part test. It's a sensory and a motor. For this motor aspect, I'm going to palpate your masseter muscle and ask you to clench your jaw. Clench. Good job. For the sensory aspect, I'm going to perform a light touch exam, and I'm going to ask if you can feel it.
Yes.
On your forehead,
Yes.
your cheeks,
Yes.
your chin,
Yes.
and your nose.
Yes.
Great. For cranial nerve number 7 is your facial. What I'm looking at for here is if your facial symmetry. So I'm going to ask you to raise your eyebrows, smile, frown, okay. Pucker your lips, and puff out your cheeks. Excellent. Cranial nerve number 8 is acoustic. What I'm looking for is your hearing here. So I'm going to block off this ear, and I'm going to whisper baseball.
Baseball.
Good job. And on this one, boardwalk.
Boardwalk.
Good, good. For cranial nerve number 2 is your vision. So for your acuity, vision acuity, I would do the chart. Unfortunately, I do not have that with me, but I can check your peripheral vision. So I'm going to check your peripheral vision by you telling me how many fingers I have out here.
1,
Good,
2,
good,
2, 1.
good, good job. Cranial nerve number 3 is your ocular motor. And what I'm going to do is I'm going to shine a bright light, and I'm going to make sure that your pupil reacts to it. Okay, so that's a direct light into your pupil. Good. And next is the consensual. So when I place a light in your eye, the other one should constrict as well. And yours did. The next exam for this is the accommodation and convergence. So what I'm going to do is ask you to follow my finger, okay? And as the patient is following my finger, their eyes should converge to their nose. Good job. Cranial nerves 3, 4, and 6 is checking your conjugate gaze. So again, I'm going to ask you to follow my fingers with just your eyes and not your head. Okay? So, excellent. Good job. Good job. For cranial nerves 9 and 10, I'm going to ask you to open your mouth, nice and wide, and say ah. Good. So what I'm looking for here is that the patient's palate and uvula both rise and they're symmetrical, and there's no deviation in the uvula. If there is, obviously there's an issue going on there, okay? Last one is your tongue. Cranial nerve number 12, and I need you to please stick out your tongue for me. Great, and I'm looking to make sure that the tongue is midline. Cranial nerve 11 is I'm going to ask you to shrug your shoulders against resistance here. Good job. Good, good. All right. I'm now going to test, and I'm going to ask you to close your eyes for me. Good. And I'm going to write a number on your palm, and you tell me what number this is, okay?
4.
Good. Excellent.
3.
Good. I'm going to place something in your palm, and you tell me what it is, okay?
A Q-tip.
Good. Good job. All right. I'm also now going to perform what you can open your eyes.
Okay.
It's called a light touch sensation to the upper extremities.
Okay.
Okay. So what you can feel is something sharp, like that, and something soft. And you tell me what you feel.
Okay.
Okay. Close your eyes. Good job.
Sharp.
Good.
Soft. Soft. Soft.
Good. All right. I'm also now going to check your vibration sensation over your ulna, okay? And you let me know if you feel it, okay?
Okay. Yes.
Good.
Yes.
Good. I'm also going to check your cerebellar coordination with a rapid alternating movement. There's 3 tests. The first one, I need you to do this, alternating it. There you go. Excellent. Perfect. Next. Good. And then I would like you to please follow my finger, okay? And then touch your nose.
Okay.
Okay. Touch, no, touch my finger and your nose. Touch my finger and your nose. Touch my finger and your nose. Excellent. All right. I'm also going to check your reflexes, okay? So can you move forward just a little bit? That's good. All right, so what I need you to do is just relax your arm. Perfect. Just relax. Relax. There you go. Good. That is the brachioradial reflex. Biceps. And this one I need to just relax your arm, like drop it in my arm. I have your arm. Good. Triceps. Good. Good. Biceps. Relax. Drop it in my arm. I have it. Good. Now sit back a little bit. Dangle your feet for me. I'm going to check your patella reflex, okay? All right. Just relax your legs. Good job. One more. All right. Now just come forward just a little bit. I'm going to check your Achilles. And sit back just a little. There you go. Check your Achilles. Okay. And the last reflex is called the Babinski. So this test requires scraping something underneath the patient's foot, and you do not want to see an adult patient flare out their toes.
Like that?
Like that. That is correct. Thank you for that. All right. So I'm going to once again perform a light touch sensation to your lower extremities. Again, you're going to feel something sharp and something soft. You close your eyes and tell me what you feel, okay? All right. Here we go.
Sharp.
Good.
Sharp.
Good.
Soft.
Good.
Sharp.
Good.
Sharp.
Good.
Soft.
Excellent. All right. All right. So then I'm going to ask you to please stand up. And this is called the Romberg test. Okay? So for this test, I need you to stick out your arms like this. Good. And close your eyes. Now, this test is normally performed for 30 to 60 seconds. The object of the test is that if there was an issue, the patient would be noted to be swaying back and forth. Don't do that. So she's standing nice and straight. And normally, like I said, this should be a test that's performed for 30 to 60 seconds. Okay, good job. All right, from here, what I'll need you to do is I'm going to check your walking ability, okay? So I'm going to have you walk towards the door. Nice and good. Good job. And then when you come back to me, I'd like you to put your heel in front of your other foot.
Okay.
Excellent. Just like that.
Gosh.
It's much harder when you're an adult.
It is.
Okay. All right. If you can, and one, I need you to hop in place. Good. One more. All right. Good. Sit down. And the last part is a vibration test on your medial malleolus. Okay. So can you sit back for me a little bit? Good job. All right. All right.
Yes, I feel that.
Okay.
Yes, I feel that.
Okay. And that finishes up the exam. Thank you.